Have you ever woken up in a cold sweat, your heart pounding, from a dream so real and terrifying you couldn't fall back asleep? You're not alone. We all have nightmares now and then. But when do these bad dreams cross the line into something more serious? Let's talk about nightmare syndrome, or as it's more formally known, nightmare disorder. First off, what's a normal nightmare? It's basically a disturbing dream that yanks you right out of sleep, leaving you feeling anxious or scared. They're super common in kids, especially between ages 3 and 6, and usually start to fade after age 10. Fun fact, in the teen and young adult years, girls tend to report having more nightmares than boys. Some people continue to have them as adults, and an occasional scary dream is totally normal and nothing to lose sleep over, ironically. So, when does it become a disorder? Nightmare disorder is different. It's when nightmares happen frequently, cause you major distress, mess up your sleep schedule, and start affecting your daily life. You might even become afraid of going to sleep because you're worried about what your mind will conjure up next. While almost everyone has nightmares, nightmare disorder itself is actually quite rare. Let's break down the symptoms. Nightmares usually strike in the second half of the night, during that deep REM sleep. The dream itself often feels incredibly vivid and real, and it gets more and more upsetting as it goes on. The storyline is frequently about threats to your safety or survival, but really, any disturbing theme can pop up. When you wake up from one of these, you don't just feel a little spooked. You might feel intense fear, anxiety, anger, or sadness. Physically, you could be sweating or have a racing heartbeat, even while you're lying safely in your bed. A key feature is that once you're awake, your mind is clear. You can remember the dream in detail, which is part of what makes it so distressing and keeps you from easily drifting back to sleep. So, how do you know if it's a disorder? Your doctor would consider it a disorder if you're experiencing a few key things. First, the nightmares are happening often. Second, they're causing you major distress or problems during the day. This could be constant anxiety, a lingering fear from the dream, or a specific fear of bedtime itself. You might also have trouble with concentration or memory because you can't stop replaying images from the dream. This can lead to daytime sleepiness, fatigue, and low energy, which then causes problems at work, school, or in your social life. For kids, it can even lead to behavioral issues around bedtime, or a fear of the dark. And for parents or caregivers, having a child with nightmare disorder can be incredibly distressing and disruptive for the whole family. When should you see a doctor? Like I said, occasional nightmares are no big deal. If your child has them, you can just mention it at their next regular checkup. But you should definitely consult a doctor if the nightmares are happening frequently and just won't go away if they're constantly disrupting sleep, causing a genuine fear of going to bed or leading to problems with behavior and functioning during the day. So, what causes this? Doctors call nightmare disorder a type of parasomnia, basically, an undesirable experience that happens while you're sleeping. The exact cause isn't known, but we know nightmares happen during REM sleep. However, there are many known triggers. Stress and anxiety are huge ones. The everyday stresses of life, like problems at home or school, can be enough to trigger nightmares. Big life changes, like a move or the loss of a loved one, can also do it. If you struggle with anxiety in general, you're at a higher risk. Trauma is another major trigger. Nightmares are very common after an accident, an injury, or any other traumatic event. They are a hallmark symptom for people with post-traumatic stress disorder, or PTSD. Believe it or not, sleep deprivation can also be a cause. Messing with your sleep schedule, not getting enough sleep, or suffering from insomnia can all increase your chances of having nightmares. Certain medications can be culprits too. Some antidepressants, blood pressure meds, beta blockers, and even drugs used to treat Parkinson's or to help you quit smoking can trigger them. Substance use can play a role as well. Using alcohol or recreational drugs, or going through withdrawal from them, can bring on intense nightmares. Other health issues can be linked to nightmares. Depression and other mental health disorders often go hand in hand with them. Some medical conditions like heart disease or cancer, and even other sleep disorders that mess with your sleep quality, can be associated with an increase in nightmares. And of course, sometimes it's as simple as what you're consuming before bed. Reading scary books or watching horror movies right before you try to sleep can definitely plant some spooky seeds in your subconscious. Are some people more prone to them? It seems so. Nightmares are more common when you have a family history of them, or other parasomnias like sleep talking. It suggests there might be a genetic component. Living with nightmare disorder isn't just about bad dreams. It can lead to some serious complications. The constant sleep disruption can cause excessive daytime sleepiness, making it hard to concentrate at school or work, and even dangerous when driving. It can also take a toll on your mood, leading to depression or anxiety because the disturbing feelings from the dreams just don't go away. This can create a vicious cycle, where you resist going to bed out of fear, which leads to more sleep deprivation, which in turn can cause more nightmares. In very severe cases, the distress can be linked to suicidal thoughts. If you or someone you know is feeling this way, please reach out for help immediately. There are resources available, and you don't have to go through it alone. The good news is that nightmare disorder is treatable. Talking to a doctor or a mental health professional is the first and most important step. They can help you identify potential triggers and find the right strategies or treatments to help you get the peaceful, restorative sleep you deserve. Thank you so much for watching and learning with me today. If you found this video helpful, please give it a thumbs up and consider subscribing for more content about health and wellness. Sweet dreams, and take care.